How do Southern health departments, community-based organizations, and healthcare providers respond to HIV clusters? Although HIV impacts the entire country, the South experiences the greatest burden of new HIV cases, new diagnoses, and deaths in the U.S. In 2021, the South comprised 38% of the U.S. population, but represented over half, 52%, of new HIV diagnoses. One way that Southern health departments work to decrease this burden is by identifying and responding to HIV clusters. These clusters represent rapid transmission, so prioritizing their response can slow the epidemic's growth. Responding to clusters quickly when they are smaller can help keep efforts manageable and limit their size so that fewer people end up getting diagnosed with HIV. When health departments identify HIV clusters, they typically begin their response with routine, day-to-day efforts, which could include these activities. Interviewing individuals in the cluster network to gather information that will help stop the cluster from growing. Providing HIV testing for individuals linked to a cluster who haven't been recently tested. This testing focuses on the areas where the cluster is located and among the people most likely to be affected, such as people who inject drugs and gay and bisexual men. Linking newly diagnosed people to care and re-engaging people who have stepped away from care, which involves prescribing antiretroviral therapy, ART, to help keep them healthier by suppressing HIV and addressing their barriers to staying in medical care. Offering a medication that can prevent infection called PrEP to people who do not have HIV. Other activities that the health department might do to respond to a cluster include sending a health alert to the communities most likely to be affected by the HIV cluster, educating healthcare providers on cluster trends, increasing programs that reduce the harm caused by substance use and access to related services. These might include clean injecting equipment, substance use treatment, food, clothing, and transportation. Working with neighboring jurisdictions on clusters that spread across state lines. Cluster detection and response activities also provide an opportunity to identify and address gaps in health department HIV prevention services by identifying weaknesses in their programs and presenting a chance to improve them and prevent future clusters. When responding to rapid transmission, health departments do their work in a more focused way to reach individuals, networks, and specific communities more efficiently. They do this with the help of others in the healthcare system, which contains multiple entities. When responding to a cluster, these entities include health departments, community-based organizations, often called CBOs, and healthcare providers like doctors, nurses, and social workers. Each one has a role to play in responding to clusters, and building relationships with these partners before clusters occur sets the stage for a quicker and more effective response. During a cluster response, Southern CBOs can provide services tailored to their niche within the communities they serve. When partnering with the health department on these responses, CBOs may conduct venue-based testing at bars, parks, and other popular gathering places. Create communications explicitly tailored to those most likely to be affected by the cluster. Disseminate resources to promote PrEP, and offer housing and health insurance assistance. CBOs have an essential role in educating their clients, community members, other local partners, and the health department on implementing a response that is sensitive to the affected community. Equally essential to HIV cluster response efforts are healthcare providers, who can help connect the health department to people who may be part of a cluster. Healthcare providers can educate their patients about services that the health department or CBOs provide. For example, assistance with notifying and testing their partners, paying for medications, and letting them know about the services the local Ryan White HIV/AIDS program offers. Doing cluster response work in collaboration with community partners can efficiently focus resources on the populations, geographic areas, or online spaces that need the most support. As you can see, Southern health departments are set up for greater success when they work with their community partners to identify and respond to HIV clusters quickly and effectively, helping meet the collective goal of ending the HIV epidemic.